Public health is designed to do just that, ensure the health of the public, specifically within the United States. Through assessment, policy development, and assurance, public health is designed to keep the effects of health issues and crisis at a minimum. This presentation will cover the 10 major functions of public health, its role in the community, the organizational structure, ethics and legality, funding, and communication. This presentation will give a clear overview on the importance of public health within the community. Public health was established to cover 10 major functions, and within those functions, public health ensures that they monitor the health of the public while researching ways to solve health issues and decrease the amount of those that suffer from illnesses. It is also designed to diagnose, investigate, and solve hazards within a community. It does so by researching epidemics, finding the cause, and eradicating that cause. Once public health is resolved, the health issues, their teams work together to educate the population to ensure that these health issues and hazards do not occur again, or at least minimize the effects of the hazard. In doing all of this, there are teams that are established that focus on particular issues, so each hazard has a team of experts responding to mitigate all negative effects. A large part of public health is prevention, and in order to prevent hazards and the health issues from occurring in the first place, public health develops policies and plans to support community health and ensuring that the public is not causing these issues while not imposing on the freedoms of the public. After these policies and plans are created, there needs to be a way to enforce these policies, so there are those within the system that concentrate solely on enforcement. Public health is forever changing, improving, and searching for innovations to solve current and past issues, and because of this, they are able to coordinate the best care for the public and are forever working on ensuring the competency and effectiveness of their programs. The goal of public health is to ensure the health of individuals worldwide while not imposing on freedoms. This is a graphic displaying the assessment, policy development, and assurance incorporated within public health. Epidemiology is the study of the agents that cause disease while comparing morbidity and mortality. The first aspect of public health designed to discover the cause of a widespread disease to decrease the effects of the issue. Some of the earliest data of epidemiology being used is by John Snow in London in the year of 1854. With the outbreak of cholera in 1854, he mapped the areas of the outbreaks, and through communication with those that had contracted cholera, he was able to logically deduce that the outbreak was coming from a water well that had been commonly used by those infected. While there is no conclusive evidence that he was right, the outbreak of cholera did decrease. Maternal and child care in public health is to reduce the rate of infant mortality, child care neglect and abuse, and to increase life expectancy. Maternal and child care is designed to increase the nutritional health in newborns while monitoring mothers of postpartum depression as well as diseases that infants can contract from their mother or from the environment shortly after birth. Environmental health covers the relationship between people and the environment. This covers air quality, water, waste management, and other aspects of the environment that can be a detriment to public health. They also inspect the community's buildings for mold and other conditions that are detrimental to community health. Injury prevention and control is important to public health like epidemiology, in that injuries have known causes like diseases. Injuries also have factors that make them preventable. By using personal protective equipment in many activities such as cars, motorboats, bicycles, work-related tasks, and in the home, many unintentional injuries can be avoided altogether. Injuries that are avoided are hospital bills that are not incurred. Substance abuse, and dependency. It is in the public's health concern to limit or stop the usage of tobacco, alcohol, as well as a few drugs. 15% of adults throughout the world have some sort of addiction other than tobacco use. This is not in the best interest of the community or public health. The goals of public health is to educate people on the harmful effects of substance abuse as well as alleviate the effects by distributing clean needles to reduce disease, and condoms to decrease the spread of sexually transmitted diseases in those populations abusing drugs. Public health also wants those with these addictions to seek treatment. Health education and promotion involves just that, ensuring that timely, accurate, and beneficial education reaches the public. Other goals are also to provide the necessary resources within the community to ensure that leading a healthy lifestyle is as easy as possible. An example of this would be smoking cessation classes. Health program management and administration, found at all levels from federal to state to community, are programs and public health administrations. Maintaining morbidity and mortality rates is just one of the tasks that these administrations are in charge of. There are also offices to ensure that those items from environmental health are being taken care of, like testing air and soil for contaminants. They also conduct research and provide education to reduce or prevent epidemics altogether. The impact of public health is Health People 2020 was established in 2010 to track health trends and create goals towards the year 2020. This program is designed to reduce mortality as well as increase the quality of life. Because of the public, people are dying less from infectious disease. There are many different agencies organized within public health, from federal, state, and local agencies. According to the Commission Core of the U.S. Public Health System, there are many agencies on a federal level. Those agencies include the Agency for Healthcare Research and Quality, which is in charge of research to better the quality of healthcare, reduce costs, patient safety, and to improve access. The Agency for Toxic Substances and Disease Registry, developed to decrease the presence and exposure to toxic substances. The Center for Disease Control and Prevention is important for the control of diseases and prevention, and also the report of diseases, injury, and disability. CDC also has a role in protecting the population from biological or chemical terrorism. The Food and Drug Administration is designed to ensure the safety of America's food and drugs, as well as cosmetics and pharmaceutical items. This is one of the oldest established agencies. It is also in charge of regulating medical devices. Health Resources and Service Administration is in charge of directing national health programs. This agency works to provide the best access for those in need, like HIV patients, underprivileged, and women and children through state programs. There is also the Centers for Medicare and Medicaid Services, the Indian Health Services, National Institutes of Health, Office of the Assistant Secretary for Health, Office of the Secretary, Program Support, Substance Abuse and Mental Health Services Administration, Office of the Assistant Secretary for Preparedness and Response. All of these agencies work separately and together to ensure the overall national health of the United States. Underneath the federal level is state and local levels, and many of these organizations work differently than their federal counterparts. Many state agencies either work under a larger unit or work individually. Many state agencies work under federal agencies. According to the Association of State and Territorial Health Officials, the most common responsibilities are long-term care, mental health authority with substance abuse, Medicaid, and public insurance. Paragraph 4, 2014. 58% of state agencies act independently. Acting under state agencies is a large number of local agencies that have their own missions and visions. The relationships between state and local agencies vary greatly from state to state. Here's a graphic displaying the many entities of public health. As you can see, there are many different agencies with very different missions that all work together to ensure public health. When creating policy and plans and the means to enforce those plans, you need to analyze the fairness of the plan. When implementing the laws that require drivers to buckle up, the freedom to choose to wear your seatbelt was taken away. Was this imposition on our freedoms ethical? One would argue that yes, this law is ethical. The use of seatbelts does not only affect the user, but those that come into harm from the individual who do not wear their seatbelt. So the good outweighs the bad in implementing laws to mandate seatbelt use. When public health begins the strategy to implement new laws The mandates have to be weighed to ensure they are ethical and constitutional. When Mayor Bloomberg created the implementation to ban the ounces of soda that could be sold at establishments, he crossed the lines of our constitutional rights. That is why this law is deemed unconstitutional by the courts. Although the non-availability of sodas over 16 ounces will greatly decrease the amount of calories being ingested, and therefore decrease the amount of the obese population, this ruling was deemed to limit freedoms in a way that is unconstitutional. Which is greater, the common choice, free to all, or the common health of America? Funding disease prevention should be one of the topmost priorities within the United States. When we keep our citizens healthy and spare our country the effects of terrorist attacks, we are ensuring a country that lives to a long and successful life. When citizens are not getting sick in the first place because of prevention plans, we are saving the United States money. So why is the funding for prevention programs suffering? According to Investing in America's Health in 2012, the budget for the CDC has deflated from $6.62 billion in 2005 to $6.32 billion in 2011. When you factor in inflation, that is a very large decrease in funding one of the largest agencies established to ensure the health of the United States. Not only are agencies suffering at a federal level, those agencies focused on prevention at a state level have also decreased funding. Because of this decrease in funding, local health departments, or LHDs, have eliminated 34,400 jobs since 2008. This is due in part to layoffs. Funding for state and local agencies vary greatly from state to state. Is it enough? Experts say no. The economy of the United States is tied to the health of its citizens, and if we are letting preventable diseases infect our citizens, our public health agencies are not doing enough. In this day and age where many of our dollars go to chronic and preventable disease, it is important to invest in the future of America. We can do this by investing in prevention. When communicating measures that need to be taken by the public, it is important to find means that will ensure the public complies with the information provided. To do so, it is very important to outline risks, prevention measures, and actions that need to be taken in a way that is easily understandable across all ethnic and socioeconomic groups within the United States. A message that is not comprehended is not followed. The largest complication in disseminating information across the United States is ensuring that it is done in a way that all classes can relate to. Because the United States is full of so many variances, this is not an easy task. Examples of the difficulty to relay messages to all of the United States can be outlined in the H1N1 pandemic. The ability for public health to communicate their risk and preventative measures at the beginning of a pandemic is highly important in preventing the spread of a pandemic. In June of 2009, the World Health Organization declared H1N1 as a pandemic after its first development in Mexico. Because of this pandemic, there has been research into the communication efforts that were produced to prepare the public in this pandemic. With communication inequalities, the spread of H1N1 was vast. Not only do you have to worry about the vast culture within the United States in the case of a pandemic like H1N1, but also within the entire world. You can imagine what kind of difficulties this would cause. When communicating the need for action, agencies must factor in all socioeconomic positions. During the H1N1 pandemic, the United Kingdom used paid advertising slots to advertise the use of tissues, frequent hand washing, and hand sanitizer. With increased volume in advertising, the importance of preventing the spread of H1N1 was also increased number of those complying with the preventive needs. When the population becomes worried, the number of those that comply increases. In conclusion, in analyzing public health, one has to address the major functions, its role in the community, the organizational structure and its effectiveness, the legality, funding, and their methods of communication. This presentation was designed to cover these aspects in a thorough manner. The role of the public health is a necessary one, and through the use of communication to ensure compliance in health issues, it is an effective one in preventing and responding to health issues, catastrophes in nature, and terrorist attacks. The general health and well-being of every citizen is important.